All of this question appear in the same day in the same exam. We will solve it, and by the end of this, you will understand the difference between SARS, sepsis, and septic shock, and bacteremia, so on. First question is about patient with fever, high white blood cells. They didn't write how much high, but more than, let's say, 12,000. And the lactate is 3. Mean arterial blood pressure is 65. Was maintained using vasopressor. What's the diagnosis? So what we can see here, we can see that there is a sepsis, high white blood cells, lactate is high, and lactate is a little normal. There is a fever, but the main concept to say septic shock, that the blood pressure is low and we maintain it using vasopressor. Other word they can use in the exam, refractory hypotension. Refractory hypotension means that they give more fluid and the blood pressure is still low. Next one, patient known with having E. coli infection, then did a urinary procedures and interventions. They developed fever, blood pressure normal, white blood cells high, respiratory rate little high. What does the patient have? Okay, this is at this question you can see that there is SARS, what we mean by SARS, and there is a source of infection. They mention here a source of infection like E. coli, urinary tract infection, empyema, cholecystitis, appendicitis. All of this is a source of infection. So first, what are the SARS? First, temperature. They are for first one is temperature, more than 38 or below 36. Heart rate, more than 90 is another one. So this is one, this is two. Tachypnea, respiratory rate more than 20. This is another one. Last one, white blood cells more than 11,000 or 12 or below 4,000 white blood cells. So if you can see two of these four SARS, two SARS plus source of infection, this is sepsis. If you only see 2 or 3 or 4 from the SARS, but you can't see a source of infection, like they didn't mention that the patient has pneumonia or the patient has cholecystitis or appendicitis or peritonitis or whatever, this is SARS. Okay, let's move to the next question, and we will review all of this later at the end. This is the next one. We have a patient post-cholangitis intervention. Few hours later, he developed chills and rigors only. Total white blood cell count was 9. This is normal. Respiratory rate 18, below 20. Heart rate 90. It's okay. Temperature is 38. So how many SARS does this patient have? 1, heart rate. 2, temperature. Okay, this is 2. Respiratory rate. So he has 2 from the SARS. There is a source of infection. Yes, there was a cholangitis. So now this patient have what? Not bacteremia. The true answer is he have a sepsis. Okay, this is the true answer. As there is 2 or more from the SARS and he has a source of infection. Woman has all 4 of 4 criteria of the SARS and has empyema, source of infection, Range 3 days ago. Now he suddenly collapsed in the ward and required intubation. Collapsed in the ward and required intubation. And moved to the ICU. Which type? Okay. This is a tricky question as he mentioned here that there is a severe sepsis and septic shock. How to differentiate in the question? Both of them have hypotension. The difference between severe sepsis and septic shock is that if they mention that they use noradrenaline or refractory hypotension, like they mentioned they give 3 to 4 liter of fluid and the patient didn't respond, so or use another vasopressor, this is a criteria for septic shock. If they didn't mention and only say that the patient collapse, so it is a severe sepsis. So we will go with answer A. So let's review all the difference between the four of this. First of all, SIRS, pressure, more than 38 or below 36. Another one, heart rate more than 90 or equal. I think it is only more than, not equal. What are the next one? Temperature, heart rate, respiratory rate more than 20. What else? White blood cells more than 12,000 or below 4,000. So this is SIRS. If they mention in the question that the patient has 2 or more of this SIRS plus source of infection, so this is sepsis, okay? If they mention that the patient have sepsis plus organ dysfunction or hypotension only, this is severe sepsis. Shock, when they mention that this hypotension is refractory hypotension, need vasopressor. If they mention in the question that the patient has bacteria in the blood but without the SIRS symptoms, this is called bacteremia. Thank you.